Good evening, good afternoon, and good morning. This is the 1559th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is ELANTHIRAIYAN. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi. That's from 7:30 to 8:30. And from 8:30 to 9:30, we have an international session in English. And from 9:30 to 10:30, local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that you can search IFPH homeopathy without paying a penny. You can watch all these videos. You can watch the previous videos also. So we have doctors and eminent personalities from 65 countries have presented various presentations on various subjects about health and all other matters also. So let us begin the session with the introduction of our guest, Dr. ELANTHIRAIYAN, MD, is the guest professor, Excel Homeopathic Medical College, Komapuram, Tamil Nadu, and he is the chief consultant of Indirag Homeopathy Clinic, Salem Complex, Tamil Nadu, India. He is a winner of many awards and has done many talks on homeopathy at various channels, as well as he has written a lot of articles in various newspapers as well as magazines around the world. And he is always interested in presenting papers in international forums, and he has presented a beautiful session here some 1 month back. Today, let us welcome the guest, and Dr. ELANTHIRAIYAN will be talking about some of his clinical experience. He's a man who has a lot of experience in treating acute as well as chronic diseases, and a man who has worked a lot during the time of COVID and has won heart from the patients for that wonderful work. And let us welcome Dr. ELANTHIRAIYAN to this session, as well as those who are attending the session. Yes, doctor, please raise, yes, please, you can unmute, you are a co-host. You can unmute yourself. Dr. ELANTHIRAIYAN,
Yes, sir.
yes.
Sir. Now, as the topic says, my clinical experiences in homeopathy. Actually, we wanted long back. I wanted to do discussing with my friends, doctors. I decided to take up some of the cases, surgical cases, as challenging, which are said to be surgical cases, where homeopathy is more effective. So I thought of taking up such cases where we have scope, where in homeopathy we have scope, for example, chronic sinusitis, for example, renal calculi, gallstone calculi, and hemorrhoids, especially the hemorrhoids. I thought of taking up such cases. So I have been treating quite a lot of cases with hemorrhoids with very good results. So usually in general public's perspective, generally from medical point of view, hemorrhoids, as we know, it's a surgical disorder which has to be hemorrhoidectomy is the only choice of treatment for hemorrhoids. But whereas in homeopathy, we do have a very good, very excellent results. I've given several of cases. First of all, I would like to give a small introduction as hemorrhoids. It is the anal cushion which is prolapsing outside the anal margin. We call it as a hemorrhoids. There is both internal and external hemorrhoids. The veins, superior rectal veins, which get obstructed, engorged within the mucosa, and sometimes when it's prolapsing into the mucosa of the anal canal. So this we call it as there are two types of internal and the external hemorrhoids. We have two types of hemorrhoids. Usually the causative factors, the etiological factors for the hemorrhoids, as we know, it is a mostly the one of the main causes is genetic. That is, members of the same family are said to be affected by this particular illness. So there is a genetic predisposition to develop hemorrhoids in individuals. So starting from the age group of even 10 to 15 years old to as high as 80 or 90 years old, many people are affected by the hemorrhoids. The other factors are usually during pregnancy, during delivery, there is a chance for developing this hemorrhoid due to obstruction of the veins, superior rectal veins by the growing fetus. And the other causes like constipation, as we know, constipation, and when the patient tries to strain during stool, remains one of the very important potent causes of hemorrhoids. In genetic factors, what happens is the anal cushion. Actually, there is a weakness. There is a genetic inherent weakness in that particular region, which gives rise to prolapse of the anal cushion, which we call it as a hemorrhoids and engorgement of the veins, all these internal and external hemorrhoids. Internal hemorrhoids is one where it remains inside the above the anal sphincter, and the external hemorrhoids which remains at the anal sphincter, canal, verge of anal canal, and the skin tags. So the outside the anal cushion, anal sphincter. So this is called the external hemorrhoids, where the symptomatology, when we look at the symptomatology of the hemorrhoids, there are stages. In the first stage, there is a very important symptom of the hemorrhoids, as the word speaks for itself. Hemorrhoids is a bleeding. Bleeding of the bleeding for rectum is one of the very important clinical feature of hemorrhoid. So the bleeding is more common in the initial stages, and whereas followed by the advancement of the disease, the bleeding stops. So it is the first stage of hemorrhoids where there is a bleeding. There is no prolapse of the hemorrhoids outside. Whereas in the second stage, as the second stage advances, the bleeding stops. There is only prolapse of the hemorrhoidal veins outside the anal canal, and automatically it spontaneously recedes back. So that we call it as the second stage of hemorrhoids. In the third stage, even after the prolapse, it doesn't get back, so it always remains outside. So that we call it as a third stage of hemorrhoids, and it does have some complications. It has some side effects and complications as such. The prolonged bleeding. Some patients I have seen, they come with a chronic bleeding. So for a prolonged period of time, especially when there is a dietary change, they start developing bleeding for rectum. So bleeding by far is the most important indication. And apart from that, there is also in the second stage, there is also pain. There is severe pain, and in external hemorrhoids, pain is more prominent, more predominant. It is a more painful condition, the external hemorrhoids, where the hemorrhoidal veins, they remain at the outside the anal canal, anal sphincter. So that is one. And the internal hemorrhoids also there is pain, especially patients do complain of severe pain, especially during defecation, during passing stool, they develop a severe pain for which mostly they come for the very important complaints of bleeding per rectum and the pain in the rectum. These are the two important symptoms for which the patients report to us. Patients do come to us, and in some of the cases, even after surgery, even after the hemorrhoidectomy, the patients have come to me. So I have gained the experience in this hemorrhoids cases where the bleeding, to stop the bleeding, we have excellent remedies for stopping of the bleeding, starting from aesculus to hamamelis. We have a variety of drugs which we use in the day-to-day practice for hemorrhoidal patients. So aesculus, I have prescribed aesculus for many patients with very good, excellent results, especially when there is a blind for both blind as well as bleeding piles. Our remedy Esculus is of very much important, like with the sharp shooting pains in the rectum during passing stool. We have especially during the climacteric period, climacteric time. During the climacteric time, this piles is very prominent, for which we prescribed this Aesculus is a very important remedy. And also there is a worm infestation like Ascaris worm infestation along with this hemorrhoid. So the other indications, usually the constipation as a associated symptom in hemorrhoids. In this Aesculus also, I give daily dosages of Aesculus 30 daily for 30 days. And also when there is a pain, along with the pain also, or when the pain is more severe, I go for a repeating of this remedy more frequently than the daily dosage. That is even 1 hourly, even 1 hourly or 2 hourly for relieving of the pain. Because most of the time, as I told, in hemorrhoids, the most important symptom, clinical feature is the pain, very severe pain, which is intolerable. Especially the pain is more aggravated during stool or after following the stool, following stool, pain after following stool. So that is a very important thing. Apart from Aesculus, we also have medicine like acid nitricum. Acid nitricum as a very important keynote symptom. I used to prescribe nitric acid when there is a sharp stitching pain, splinter, as if there is a splinter in the anus, in the rectum. So this sensation of a splinter in the rectum, sensation as if some sharp pain. So acid, nitric acid is a very important, especially it is indicated in fissure, anal fissure. Apart from hemorrhoids, uh, in some cases I have treated pregnant women after delivery, normal delivery, due to overstraining and stretching of the rectal mucosa, they develop a fissure in ano. So fissure in ano is also one of the very important conditions, very painful conditions. So after delivery, the fissure in ano as well as hemorrhoids. So they develop also hemorrhoids after delivery. As I told, the causative factor, the important cause is the obstruction of the superior hemorrhoidal veins by the growing fetus, which pushes which causes compression on the rectum and superior rectal veins. So that causes hemorrhoids. Along with the hemorrhoids, they have a severe pain, and also for fissure in ano after delivery, because due to overstraining and stretching in after delivery, they develop this fissure in ano. Very good remedy. Nitric acid I have prescribed with very good. There is in the acid nitricum. As I told, I give frequent when the pain is more severe. Ask them to take 4 times daily, 30. And when it is not better, we do 200 potency, 4 times daily, or 1 hourly also. Very good results. And also for stopping of the bleeding, because the patient is very anxious when there is bleeding per rectum. So they don't know that it is due to hemorrhoids. They think that some serious illness is there. So they're anxious. They're very anxious about the bleeding. So bleeding is very important symptom, and our medicines do work excellently in stopping the bleeding. And where we have our great medicine, Hamam is prescribed with a very good result in cases of bleeding hemorrhoids. Though we give on the basis of symptomatology, as I say, Hamamelis is a very excellent remedy for bleeding from venous bleeding from any orifices. The Hamamelis is a very important remedy, and also in bleeding hemorrhoids also, we I used to prescribe hamam with very good results, and 4 times daily, 1 hourly, some like that. The acute bleeding stops immediately with the very excellent results. And we give prolonged treatment based on the other symptomatology, like the constitutional medicines and also indicated medicines given for a prolonged period of time. And along with that, constipation. So we in hemorrhoids, more importantly, I give the food restrictions or the modulate the food. So general as a general measure, what we have to what I advise to the patient is to take such foods which avoid constipation, because constipation remains as a very important aggravating factor for the hemorrhoids. Even though we give medicines, patient is better, pain is better, bleeding is better, they go on taking some foods which causes constipation. Some foods they fail to take foods which fiber food, fiber food. The fiber food and fluids also, fluids and fibers, especially the vegetables which contain more fibers and fluids. Fruits, I advise them to take fruits, more fiber and more fluid food. The vegetables and fruits, very, very essential for relieving constipation, because even if we give the medicines, medicinal aspect is very important, but apart from that, their food habits, because the food habits lead to constipation. Constipation leads to aggravation of hemorrhoids. So clinically, what I have experienced is the more important vital thing is their food habits has to be regulated, because many people don't take fiber food. Many people don't take green leafy vegetables. So daily I advise them to take a green leafy vegetable compulsorily in the lunch, and bananas. So the bananas also as a very important laxative like thing, which is very, very essential for relieving constipation. Take more of fruits, juices, more water. At least some patients, especially during the hot summer, you see last year and all, we had a very high temperature. So during hot summer, they don't take, they fail to take fluids. So take more fluids, more water at least. Increase the bowel movements. So the bowel activities, bowel movements, and more of a fluid and fiber food is very, very essential for relieving the constipation. I advise them to take. So food is very, very important in my consideration, in my view, very, very an essential factor for relieving this. So take more of a green leaf vegetables, especially the non-vegetarian food. They take more of a spicy food, very, very spicy food. Especially, I found clinically many cases. They say, sir, immediately after taking chicken, especially the broiler chicken, I have developed bleeding. Many cases, non-vegetarian people who take non-veg food, after taking the broiler chicken with the spices and all that, immediately the bleeding starts. Immediately the pain starts, very severe pain. I encountered in many cases. I have listened patients saying that after taking that. So I we advise that during the treatment period to avoid the more than the chicken or the non-vegetarian food, the spices which we add. As we know, we take a lot of spices and all that. So the spices go and aggravate these hemorrhoids, whether the bleeding as well as the pain. When there is in all types of internal hemorrhoids, these spices really do aggravate. So take less spices, and uh, probably avoid this. Taking broiler chicken is a very, very important thing. I have noted, and my clinical experience, we don't find it in the textbook that chicken causes aggravation of hemorrhoids. But these are all clinical things which we encounter when we meet the patients. It's not one or two. It is not that one patient said that I have aggravation of piles by taking broiler chicken. Many of patients, invariably 7 or 8 out of 10 patients do complain that I do get aggravated immediately after taking this chicken, any form, whether it is a fried chicken or boiled or whatever form we take. immediately the bleeding starts and the pain starts. So I advise them not to take or avoid during the treatment period at least. Once we get better, once the bleeding stops, the swelling reduces, once the pain stops completely normal, then after that you can take. So we advise it is not the treatment of piles only, the bleeding stops or pain stops. So we need to go for a I advise them to take a course of treatment for a period of 6 months because what happens is the internal hemorrhoids, accepting the symptomatology, that is the pain, bleeding, and constipation and others, when they are sometimes they are asymptomatic. Even the hemorrhoids remain asymptomatic. Even I do hear patients say that I don't have any symptoms, sir, but I have hemorrhoids. So or on examination, they found it that there is a hemorrhoid. Or sometimes it prolapses and then goes back. No symptoms, no pain, no bleeding. So they don't care about it. And in later stages, there is a chance for complications like it can lead to hematoma formation. So the blood clotting of the blood within the engorged veins can give rise to hematoma formation. Or the long-standing prolonged piles can give rise to infections. So infections can give rise to very severe complications. And even the portal system, the infection can spread to a portal system, a portal venous system. So this type of complications are there. And prolonged bleeding. So the prolonged bleeding also, in some cases, not in all cases, I have seen patients for several years, they have this bleeding. They don't just take some food or some local country medicine and they don't seek a treatment, either allopathy or homeopathy. So they develop a anemia. I have seen patients with severe anemia with hemorrhoids, prolonged chronic hemorrhoids for several years, bleeding for any internal bleeding in the internal organ for a prolonged period of time can give rise to anemia. And severe anemia can give rise to cardiac failure. So this is we think it is a very simple thing or piles bleeding, what is there? But it goes in for complications. Chronic prolonged bleeding can give rise to anemia. And if not treated, if not dealt with properly, it gives rise to severe anemia. And severe anemia can give rise to heart failure. See, a small thing leads to a very major cardiac complication of cardiac failure. So even such cases do happen because they are not aware of the consequences, complications, sequelae of this illness. So some cases it develops like that. I've seen anemia, patients with a chronic prolonged bleeding with developed with the anemia. So to stop the bleeding, I give hamamelis for venous bleeding. So venous hemorrhage, hamamelis and millifolium, the arterial bright red blood. So millifolium also is one of the important remedy for. So the indication is bright red bleeding, but here it is a hemorrhoids is a venous blood. But still, uh, millifolium also helps. Millifolium, erigeron. So this type of medicines we do give when to stop the bleeding because continuously the piles bleeding is there and the pain, especially when there is a severe splinter-like pain. And apart from this, we have another remedy, ratania. So ratania also very, very helpful in the sharp stitching pain, a very sharp stitching, cutting pains after passing stool. So there is aggravation along with the constipation. I have prescribed ratania very frequently. I use ratania for a pain, very severe splinter-like pain, and along with the constipation, there is a stitching type of pain, knife-like sharp pains. I have prescribed ratania. So ratania, without ratania, we cannot think of piles treatment or painful piles. So painful hemorrhoids, I give ratania, which because what patient thinks is sometimes they need immediate relief. So then only they are interested to follow the treatment. Even though we have constitutional remedies, we can give constitutional remedies after the stopping of these symptoms, acute symptoms, pain and bleeding and all this. Prolapse without pain and without bleeding, there is a blind piles. prolapsing and going back, recedes back. In such cases, we can start with the constitutional remedy. Whatever their constitution, we can go for constitutional remedy. But this acute phase, unless we give a relief, then a patient may not be, cooperating for the continuing of treatment. So I do have a good number of cases of hemorrhoids and quite a lot of cases, especially for the last in my this 30 years of experience. I've been even today till we are giving good results in cases of hemorrhoids because it is a surgical illness. Many patients they are afraid, they're scared of going for surgery and its complications, so they do come to homeopathy. So I give a acute management. First, you relieve the pain, bleeding, and the constipation. So, and along with the bleeding and the pain, so the constipation is associated. The Nexomica also very another important remedy. What happens, as I told, food habits and life, these things are very important for Naxamic acid. Know these high living people and they take alcohol and this non-vegetarian food. Then sedentary life, overworking night, working or watching. So this type of sedentary life, the very important symptom ineffectual urging to pass stool. So in cases of piles, blind piles, so we can think of Naswamika with the ineffectual urging to pass stool. I do Naswamika even for constipation. So as we know, Naswamika is a wonderful remedy along with other gastric symptomatology, and it is taking of this type of the alcohols and all that, non-vegetarian food, chicken and all that, overeating, sedentary life. So Naxamica is an excellent remedy. I prescribe Naxamica for gastroenterology. All many complaints on ulcers, gastric ulcer, even mouth ulcer, gastric ulcer, alcohol. Many people, nowadays they take alcohol daily basis. They develop the acidity, ulcer, acid peptic dyspepsia. So Naxamica, and along with the hemorrhoids, this type of life, the habits and their lifestyles, sedentary life and all, ineffectual urging to pass stool as a keynote. Naxamica prescribed on a frequent basis along with their constipation. Very importantly, constipation and the patient goes to the toilet, not able to pass fully. There is no satisfaction. They pass only very little quantity and come and then still unsatisfied goes back again. So this we call as the ineffectual urging to pass stool. So Naxamica is excellent remedy. Naxamica is a very leading remedy in many of the gastroenterological symptomatology, gastrointestinal diseases, starting from mouth ulcer to rectal diseases like hemorrhoids, like piles and other ailments. So it's a we cannot forget the Naxamica. So Naxamica I prescribe very frequently because some cases they come with constipation and due to these food habits and all that. So Naxamica is also an excellent remedy which I frequently use. And then next one is the fluoric acidum fluoricum. Again, there is a it's a very important medicine which I have used for piles cases. Very sensitive to touch, weakness of the rectum, anal sphincters. So we think of fluoric acid. Acid fluor and acid nite, especially, they are also more indicated in fissure in ano. So fissure in ano is again very important condition. Even due to constipation, many patients do develop fissure in ano, and the pregnant ladies after delivery they develop a fissure in ano. So nitric acid and acid fluor. Acid fluor is also due to a very sensitive and sensitive to touch, weakness. So as we know, weakness is a hallmark of acid group of remedies. I used to prescribe acid floor and acid night where there is a splinter-like pains in the rectum. So I prescribed nitric acid. frequent dosage and frequent repetition, 30 to 100. 30 when it is not helping, then we go for 200. Daily night, 2 times daily, 4 times daily, 1 hourly. Because here, as we know, the pain is more important. Pain is a more marked symptom for which the patient do report to us. So to relieve the pain is a very essential factor, along with the pain also, bleeding. So bleeding and the pain are two important symptoms. And when there is a prolapse of the hemorrhoids outside also is a very important symptom in hemorrhoids protruding outside. So internal piles which prolapses and gets back. So these are also very important. So we have to stop the bleeding and arrest the pain is are the two important, two, three important symptoms which we need to take care of. So after that, then we start with the constitutional medicine, go for a prolonged period of treatment for about 6 months, like that. We give a course of treatment. Along with that, the changes in food habits. So all this helps us to get rid of this illness. And in association with this are another important pathology in this rectum is the uh, fistula in ano. So fistula in ano is nothing but the infections in the perirectal region around the rectum and anal cushion, the soft tissues, the fats which collect, which is outside the rectum, which supports the rectum. So those areas get infected and give rise to uh, fistulous opening outside the anus, around the anus. There is a opening. There is a fistulous opening from the infected area. There is a discharge, first discharges. So I do get along with the piles or separately. Most of the time, it is associated. Piles, hemorrhoids associated with the fistula. Many patients who come to us along with the fistula. Again, fistula, again, we have a wonderful result. The drugs like Heparsol, Silesia, gunpowder, sulfur. So these are all excellent remedies which I use to prescribe. Especially Heparsol is of immense because suppuration as a hallmark, suppuration both in Silesia, Heparsol, in both the acid group of drugs also very helpful in fistula. Fistula because what happens is even I used to get cases even after surgery. They have undergone surgery for fistula. They remove the pus. They do all this suturing, dressing, and all that. For 6 months, they put him an antibiotic. For 6 months, he'll be all right. Again, after 6 months, there is a recurrence. Because, as we know, the rectum, which is frequently exposed to bacteria through the feces, this area of the perirectal, perianal area is frequently prone for infections, frequently prone for bacteria. So there is a chance of recurrent infections in fistula. So what they do is even after surgery, there is a even the surgeons to say that it is likely to reoccur. We cannot assure you that it will be also. Such cases I have seen cases 3 times they're operated. Patient who was operated for 3 times for fistula reported to me with the remedies, with our homeopathic treatment for a period of 6 months. Excellent results have given. Have given very good results. The discharges stop, even the openings close. Because here we have to, one is the symptoms of discharge of pus in the perianal region. And apart from that, after the discharge and all stops, there is a cavity like formation. There is a cavity formed in the perirectal area. So, like this, so I will show you this is the rectal picture. There is a case of fistula where there is a this is the first pockets around the perirectal area. There is a fistulous opening. There is a sinus-like opening outside the perianal region. So which gives rise to uh, discharge of pus. So we, apart from the uh, giving relief to the first discharge, we also have to cure the infections, the first pockets which develops outside the rectum, around rectum. So unless we give a chronic constitutional treatment of long period of time, then there is again a chance of recurrence as we see in allopathy. So I again advise them to take a treatment period for a period of 6 months, even if the what they do is once the symptoms disappear, once they are feeling better by this pain, and there is also a chance of there is also a bleeding also is a symptom from the opening. They develop first discharge, bleeding, and the pain both in fistula also, and sometimes the fistula's opening connects to the bladder, and so the infection becomes very widespread. In females, it's also can connect to the cervix, and so that fistula's opening can I mean can get connected, and there can be a sinus like opening with the others adjacent structures like in bladder in men and in women, so the cervix and also uh, vagina also it can sometimes get connected. So it can be a lingering problem, chronic infections. Even in allopathy with antibiotics and surgery, they don't respond. And even if they respond, it's only for a quite short period of time, maybe 6 months. Even after 1 year, they develop. There is a recurrence of fistulous opening. So this is a continuous phenomena where we have excellent scope. Silesia again is a very important remedy for fistula, and nitric acid again is with very good result I have given nitric acid. And the gunpowder and sulfur also very good important medicine for this fistula. Uh, the, to stop the discharges and the bleeding stops. And I give a prolonged period of time, repeated use, I mean prescription of Silesia in cases of fistula is very effective in curing the illness, not just a acute management, even for a chronic management of completely stopping the symptoms, the recurrence of pus formation, pain, and closure of these fistulas opening. So we may need other drugs also. So I used to prescribe as and when required, depending upon the cases. So overall, what I would like to say is this pathology of the rectum, diseases of the rectum like fissure, fistula, and hemorrhoids, very important, and we can do wonders because now I have patients even after 10, 15 years, they do come to us. Sometimes, after getting cured, they maybe due to aging or due to some food habits and other things. They say, Doctor, I came to you for 10 years back. I came to you for hemorrhoids. You treated. It was all right for all along for 10 years. Now there is a due to there's some food changes. Or what they do is they take the other drugs for allopathic drugs for other illnesses. So that may also aggravate because uh, there are chances of aggravation. In many cases, I've seen in skin diseases, for example, they are under our homeopathic treatment and with a very good improvement is going on. Suddenly, they fall ill with fever and cold cough. They take some antibiotic for 1 week or 10 days, and they develop again a recurrence of this skin ailment, which have been curing very nicely. Suddenly, and they say, no, it is not due to our drugs, no relationship between the two. But I strongly find that there is a relationship. So, like that, some patients take other treatments or due to food habits, they don't uh, follow the strict food habits. So, they take some of this chicken and alcohol also, all that, like lifestyle of the patient. Smoking also can aggravate this constipation, piles and all that. So they are all related. The alcohol, like, especially along with the non-vegetarian food and all, they get affected. Our patients don't take fiber food or they don't take fluid. Some patients don't take any fluid food or fruits or even some have the habit of not taking water at all. Even 500 ml of water or 1 liter, less than 1 liter of water they are taking, they don't feel thirsty. So what happens is the intestines, due to lack of these fluids, then they develop constipation and many illnesses. This water is very, very important. So I advise them to take 2 to 3 liters of water per day. So to increase the flow, because it needs like a laxative, what we say lubricant for the engines. So our this intestine as an engine, the very important lubricant is the laxative, especially the fiber and fluid food. So I advise them to take fiber and fluid foods, vegetables, green leafy vegetables, daily one green leafy vegetables, fruits, along with take not just the juice, along with the fruit pulp you take. So that is a very important fiber food, papaya, bananas, oranges. So all these fruits, so it needs more of laxative. So banana is a very good laxative. So daily night ask them to take bananas, take more of buttermilk, like that. So water, more water. If suppose the poor patients can't afford to take fruits and all that, at least to take water. So this water is again a simple thing. We say water, no, what is water? What it is going to help? But it is immense. It is of immense help, especially in this constipation, hemorrhoids, and all that. To take more water, because many patients I see, I when history taking, they say I don't take much water. I don't take much fluids. You know what they, mm, especially people in the marketing field, especially people who are driving vehicles daily 100 kilometers, marketing people, no, they have two-wheelers, they daily they are. Another important factor I forgot to say, this driving in two-wheelers, it aggravates the hemorrhoids, because what happens? Injury to the rectum, injury to the anal cushion. When every these ups and downs, fits and falls, when they jump, no, it causes injury like a suspension. So this is like because they are sitting directly on the two-wheeler seats, no, rexing seats. So due to continuous driving, injury, they are prone for injury and heat of the resin and all that causes aggravation of piles. Very clearly they say, sir, after the driving, my work is marketing. So when I have to drive a two-wheeler daily 50 kilometers or 100 kilometers, I develop aggravate. My piles get aggravated naturally because injury to the anal cushion, injury to the rectum, injury to the anus. So they develop uh, bleeding and pain, severe pain and bleeding along with this and all. So, arnica also we can think of when there is injury, pain after injury to the rectum also. Arnica is also one of the important remedies which we can think of. And based on the other symptoms, whatever the indicated remedy. So these are all the day-to-day life events which affect the piles. So the piles, apart from genetic factor, it's mostly related to the lifestyle, the food habits, which by altering and sedentary life, even the shopkeepers who are sitting in the shop for several hours, they are also prone to develop this sitting posture for a long period of time. Also, is one of the important causative factors. So, by considering all this, again, walking is very important because no movements, no exercise, no walking, sedentary life is a very, very important factor for constipation. What happens is when you ask the patient to walk, so the abdominal muscles, by walking, not only the legs do get exercised, but also the abdominal muscles get exertion, they get exercised. And the abdominal muscles push the intestines so that the motion is passed, the bowels are compressed. So without that, many people, they don't know the importance of walking, importance of exercise. So they keep sitting in the room, or retired people after 50, 60 years. They sit idle. What is the movement? There is no movement. There is no exercise. There is no work for abdominal muscles. And everything becomes slow as the age advances. Sluggishness, slowness, intestines don't get exerted, and no passing of stool. Constipation develops. Constipation leads to hemorrhoids. So compulsorily we must advise them to walk so that it is their abdominal muscles get exertion. So good walking, good food, more of a fiber and fluid food, avoidance of some more spicy food, chicken and all that, alcohol. So take a good food, green leafy vegetables, more water, and this gives 50% relief more than medicines. Medicines only the balance 50%. 50% results by changing of the lifestyle, food habits, exercise. So exercise is not only for cholesterol or hypertension or diabetes, even for constipation is a very important thing which we must I advise to the patients. So exercise really gives a good thing along with the food and other medicines also. I am not saying that these are the only medicines. As we know, homeopathy, we have hundreds of medicines we can try, and every doctor will have his own experience. The drugs may be this group of drugs. Again, Colinsonia canadensis is also one of the important drugs which I have been using for hemorrhoids. Colinsonia also is a very good medicine for venous congestion. Along with the hemorrhoids, there is also heart disease. Heart disease associated with the hemorrhoids, portal hypertension, along with the cardiac failure. So the entire venous stasis, there is a entire venous stasis, obstruction of the veins, rectal veins, and along with the hemorrhoids, there is also association of varicose veins to hemorrhoids. So it is noted that there is a concurrence of hemorrhoids along with varicose veins. So the venous, entire the venous system, there is a stasis of venous system. There is obstruction of venous system that also causes hemorrhoids. So sometimes it is a correlated are associated with each other. So in such cases also, then again, for varicose veins, again, carboveg, acid floor, hamamelis, again, excellent medicines for varicose veins. So, along with varicose veins, the hemorrhoids. And colinsonia also, again, the heart disease associated with the hemorrhoids, venous stasis, venous obstruction, hypertension. All these are correlated. So, we can think of colinsonia canadensis as a drug. And other doctors may have your own experiences. You please do share. I will also learn in other drugs, other unusual drugs. Sometimes, in seminars, conferences, we hear here, we get to know about some unusual, usual use of some unusual drugs which we don't think of in hemorrhoids, or even other drugs for hemorrhoids also. We can give the tips and the indications, so we will learn. So this seminar is only for learning. So all of us, we can learn more and more when we have every individual has an experience, every doctor has experiences. So we go pour all the experiences, all our ideas, all our knowledges get connected. So we get more light is thrown on our clinical thing. So in future, it may be helpful for all of us. So I request you to uh, please share other your experiences also in case of hemorrhoids. I will take participate, and I will see the videos and get benefited. Uh, so, sir,
Yes, thank you,
so
Dr.
please,
Evan, for such a
thank you, sir.
beautiful session in this evening, sharing your experience with
Thank you.
piles and its management, and of course, the hemorrhoids, fissures, fistula, all those things comes under this heading. But you have beautifully narrated about all these things. And as we used to say that there is no man without piles and women without lecturia, but things are entirely different now. Things happens in a different way. A lot of women are when patients are coming to us with the hemorrhoid. So the most important point, the another big point I must say here is that the mental trauma, that is the stress, that is the biggest cause for this
Yes.
incidents. And people used to say that I used to take this food, but food is the secondary as far as the homeopathy concept is concerned. You can
So,
live with it, particularly we used to say that the chicken and all of these things make things worse. But we have cases where patients used to take this lot of chicken, and but still they don't have this thing, and because it is it depends upon the person's reaction to the particular substance. And The most important point one need to take during homeopathy case taking is the mind of the patient. And anyway, it's a beautiful session. Really, thank you for that. Let us go for the discussion here. Dr. Beatrice from Germany is all ready for that. I invite Dr. Beatrice to take the session.
Yes, thank you very much. Dr. Mani, it was a very, very interesting session. Thank you so much for your clear explanation, which is the cause of the disease, which is the cause of the chronic disease, and the remedies. So I totally agree that alimentation is very, very important, and also movement, the sedentary habits, to sit, that's terrible. So here in Germany, as an important remedy for hemorrhoids, we also have a lot of Nux vomica, I can tell you. And also Dr. Hahnemann, in his days, he was advising his patients that they should walk in the nature at least 1 hour per day. Dr. Hahnemann was saying this, no coffee, no alcohol, and then he started his treatment. So thank you very, very much. And I would like to ask a question. Hamamelis is a very, very good remedy. And once it did help me a lot with a pregnant woman. There was a bleeding inside the uterus, between the inside of the uterus and the placenta. So a dangerous situation, the bleeding, the woman had to lie down and no movement, and it was more or less in the 30th week. So Hamamelis was working very beautifully, really, really with good result. And my question to you now is, could you give a little differential diagnosis between Hamamelis and millefolium?
Millefolium is a remedy indicated for arterial bleeding. Bright red blood is the hallmark of millefolium, while hamamel is venous bleeding. Dark red bleeding of hamamelis. So in hemorrhoids, there is a veins, rectal veins, which bleeds. So usually it is a it is more goes more in favor of hamamelis. Whereas if it is any other bleeding from other areas, from arterial bleeding with a bright red bleeding, we can think of millefolium. So these, in my view, are the two fundamental differences. One is arterial, another one is venous hemorrhage. And millefolium is more of an active arterial bleeding.
Yes,
This hamamelis
yes.
is the passive venous bleeding. Especially for hemorrhoids, we think of hamamelis. In uterine bleeding, bleeding disorders, in bleeding of a woman, dysfunctional uterine hemorrhage, we can think of millefolium. Whereas in hemorrhoids, bleeding of hemorrhoids, we can think of hamamelis. So
Yes.
that way.
Yes, thank you very much. And as there are no more questions at the moment, another observation from me in my clinic, I had a young woman who was operated at the hemorrhoids, and she developed afterwards colitis, inflammation of the intestine, a colitis. So this is also, we have to be aware of this, that the operation of the hemorrhoids can make a suppression. And that lady was helped by Staphysaria, and she was getting better.
Yeah.
Thank
Surgery.
you. Thank you.
Ailments from surgery. Very
Yeah.
good. Staphysaria is that remedy. Thank you, madam. Good night.
Thank you.
Hello.
Dr. Daniel, you have to unmute,
Hello.
please.
Hello.
Yes.
And now we invite Dr. Hariharan sir to say.
Okay. Hello. Yeah. Good evening, Dr. Beatrice. Good evening, Dr. Very good to see you all. Doctor, regarding the hemorrhoids, class is fine and fantastic and very good, informative. But I like to say some more things. That's all. See, one thing I usually in my case taking, preferably I will take the thermal reaction. It is one of the main point while I am taking a chronic case of hemorrhoids. See, certain constitutional medicine usually comes under see hemorrhoid cases or see lycopodium. It's a hot patient. Merxol, it's a ambithermal, and Naxomica is a chilly patient. And see the sepia, lachesis. Lachesis is one of the best medicine. That's a hot patient. See, like Kalicar, which is chilly patient. Likewise, while I am taking the cases, I will preferably inquire about the see the thermal reaction. That is that one of the main thing I like to add. See, this is this only. Because another point I like to say. See, itching of anus with piles. That is rattan here is one of the best medicine. Itching should be there. See, another thing I like to say, oozing from anus, sticky fluid oozing from anus. That sepia is one of the best medicine. Sepia. Then for bleeding piles, see, try mucuna also. Mucuna, one of the best medicine. Mucuna, one of the best medicine. And see, the painful piles, profuse bleeding of hot patient. That is lachesis. That is lachesis.
Lachesis is a medicine for hemorrhage, bleeding of veins, venous bleeding, prolonged chronic bleeding. Lachesis also is very important.
Lachesis.
Long-term treatment.
Another thing, see, protruding piles with the different heads. Aloes is the best medicine.
Aloes, yes, aloes. Bunch of grapes like
aloes. See, a lot of cases I have to wait with the aloes, tennum, 1 dose. Such cases. Aloes, tennum. In 1 dose, I have cured even the protruding piles of an infant. That is a wonderful.
Very good.
Infant. See, washing painful piles with the washing of hot water. That is a specific symptom of lycopodium. Lycopodium. At the same time, painful piles with the washing of cold water. Merxol is the best mix.
Yes, sir. Anyway, it's a very good session, discussion going on, but unfortunately,
discussion is going on. See, I see if
no
I am
time.
okay. I am discontinuing.
We can have a discussion later, as and when time permits. Okay, now I invite Dr. Beatrice to say a word of thanks to the session also.
Yes, thank you so much for the very, very nice session and the clear clinical pictures and advices you gave to us. And I'm very happy to see that we are coming from different countries, but we understand each other and we can share our experiences. So thank you very, very much for joining, and please come again. And thank you also very much, IFPH, for conducting every day these sessions. Thank you very much, Dr. Danesh, for your care. And hopefully we meet again.
Thank you, ma'am. Thank you.
Thank you, Dr. Beatrice, and thank you all for joining the session. Thank you once again, Dr. ELANTHIRAIYAN, for such a beautiful session in this evening. And tomorrow we will have a session from Dr. Rashmi Shukla. She will be discussing about understanding and explaining futurist homeopathy part 2. The part 2 was done some 3 days back, and this will be another big session tomorrow. Hope all of you will be with us tomorrow at the same time. Thank you and good night to all. It's over to Dr. Mariamma John to moderate the Malayalam session.